Once we get to preschool, now we're talking between the 2 to 5 year old age or the 3 to 5 year old age. This is where we might see articulation problems. Now, again, not all of our children from 3 to 5 have perfect diction, but if we start to see it becoming a consistent effort or consistent issue over many words, we might want to take a look at an evaluation. Mm-hmm. If they have a small, very limited, restricted vocabulary or no vocabulary at all, if they are easily distracted, have difficulty learning their ABCs, their numbers, days of the week, these are the all common things in a preschool where they cover these materials every morning. If they have difficulty following directions, and again, we have, the terrible 2s and the tremendously terrible 3s, so they, where they're seeking out their independence. But again, it's looking at how intense these behaviors are and how much they impair the child over a period of time. Again, we know temper tantrums are very characteristic in that age. So temper tantrums alone do not necessarily mean your child has any type of challenges. Mm-hmm. Once we get into elementary school, this is where we start having more formalized programs, more structured environments. This is when we start to see some of these diagnoses of ADD, bipolar, or the more academic learning disabilities popping up. Children with poor coordination, they're clumsy, they have difficulty navigating their surroundings, short attention spans, are easily distracted. And let me just preface that by saying some of our kids who are diagnosed with attention deficit disorders, you put them in front of a Nintendo game and they can sit for hours. But if they're having difficulty in more structured environments, that's a concern. Difficulty sustaining topics during conversation. If you have an individual who tends to, or a child who tends to frequently switch and stay off topic, excessively silly behavior, doesn't know when to stop doing certain behaviors, can't get his schoolwork or her schoolwork organized. Those are what we tend to see in the elementary age. Adolescence to adulthood, difficulty making friends. That's a period when friends and peers tend to overtake the power that parents used to have and the influence. So if they're having difficulty making friends, that's usually a sign that there might be some social awkwardness, that they don't know how to really engage appropriately. If they have trouble understanding body language or facial expressions, difficulty adjusting to new settings, pays too little attention to details or focuses too much on details. If they work slowly, if they're sexual acting out or substance abuse, these are engaging in thrill-seeking behaviors. These are all things that we might say those are red flags that might need to be further evaluated.
When you start seeing a continual pattern of those and a large amount of those different characteristics all surfacing in one child, then it's time to maybe move on to the next step. And Sharon, what's the next step in that case?
The next step is seeking out a screening, and a screener would be great. And again, our mobile clinics are available in the community. You can get a free screening. They're done by professional clinicians in partnership with University of Miami and Florida Atlantic University. We also have a developmental clinic at Nova Southeastern University. It's the Unicorn Children's Foundation Developmental Clinic. University of Miami has an autism screening and assessment clinic available, or you can go to your pediatrician. We can refer you. Typically, the individuals that are on an evaluation team would be a psychologist or a developmental specialist. Depending on the particular challenges a child has experienced, it might include a speech therapist, an occupational therapist, trained in sensory integration. It may include social workers, physical therapists, psychiatrists, developmental or behavioral pediatricians, educators, pediatric neurologists. But your key is to really look at what are the primary challenges your child is having. If it's just simply their communication abilities, you may want to first approach a speech and language pathologist who will probably be able to refer you to a clinical psychologist who specializes in children with developmental communication and learning disorders. Again, we at Unicorn Children's Foundation can do the same, but I just want to, if we can avoid some of the middleman through the information we present on Dare to Dream, I think it would be helpful. Usually, you really need to get a team of professionals who are going to collaborate and discuss what profiles they're seeing in the child, because the purpose of the evaluation is really to set up a roadmap for your interventions or your therapies to help remediate the weaknesses that the child is experiencing. So if it's not providing a cleared roadmap, it's really not worth the paper it's printed on. I've seen many evaluation reports come in and they have all these numbers and substandard scores and for standard deviations, for your typical parent, and even for some professionals in the field, it really, you look at it and say, well, what does that mean in terms of this child? If we have a child with auditory perception and with a standard deviation of 10, it doesn't really tell us what we need to do going forward. So if parents are getting reports like that, they really need to go somewhere else or demand a further explanation so that we have a roadmap. The evaluation should really provide an objective description of the child's strengths and weaknesses. The evaluation is used primarily to determine eligibility for services, and aid, again, in a comprehensive intervention plan, but it also provides a baseline of where the child was at when you started so that you can use that to measure progress across time.
All right. And so Sharon Alexander is with us. She is the executive director of Unicorn Children's Foundation. Our show is Dare to Dream, and we're talking today about children and families and professionals all dealing with learning disabilities. It's a relatively new field in the medical profession, and we're following along today. We're sort of starting off with an imaginary case where a family feels that their child may be exhibiting some of the characteristics of learning disabilities, and kind of walking through the process, discovering what those different characteristics are, and if it means that it's time to move on to the next level, which is to seek some professional help. And of course, we don't want to throw a wet blanket over medications, because medications in their place are certainly good, and there are certainly if there's one thing that is not new when it comes to learning disabilities, it's medications. There are a wide array, and we should probably touch on it a little bit. Some of the names of medications that you may have heard before, if you could run down some of those.
A lot of children, we've seen the use of medication to treat ADHD triple worldwide. Mm-hmm. Ritalin, Concerta, Adderall. They're coming out now with patches and different mechanisms to transmit the medication. They're all stimulants, which you would think if you have a hyperactive child, why would you give a child stimulants? But there's something within the neurological wiring that these stimulants actually help to calm the child. So they actually react a little differently than a typical adult taking the medication would. We're starting to see medications being utilized to mediate some of the more challenging behaviors with individuals with autism. You have, within a given individual with a given diagnosis, you might see anxiety issues, and medications are used to sort of bring the anxiety levels down to a more manageable level. Aggressive behavior, Risperdal is often prescribed. Again, I don't want to say to any parents that this is my expertise in terms of which medications to use. You really need to see a psychiatrist or a pediatric neurologist who can better guide you in the right direction. But medications are not to be the cure-all pill. They alone will not help change any behaviors. They simply should be utilized to bring the behaviors down to a more manageable level where interventions can be more effective, and then they can be eventually weaned off the medication or weaned down to